Hello, everyone. My name is Dr. Sophie Lebel. I'm a clinical psychologist and I'm a professor at the University of Ottawa in the School of Psychology. If you're a cancer patient, you probably have had the thought in the past of, what if the cancer comes back? What if my cancer progresses? So having those thoughts is very common. So when we ask cancer patients, have you ever had this thought before? I would say, 95% say yes. Now, what becomes apparent though is that not everybody struggles with fear of cancer recurrence, but a significant portion of patients actually have difficulties managing this fear. And our latest research would show that it's about 60% of cancer patients that have at least elevated high levels of fear of cancer recurrence. So these are people that I would see in private practice or in my interventions, and I would offer them potentially solutions. So the reason for studying fear of cancer recurrence is that it's very common. And not only is it very common in the patients, but it's also as common in the caregivers. So the loved ones, the family members, the partners of people who are taking care of the patients are also experiencing this high level of fear. So interventions can be geared towards the patients, but could also help caregivers. In terms of the sort of practical implications of my work, so obviously when one struggles with fear of cancer recurrence, it can have a big impact on their quality of life and sort of day-to-day enjoyment and engagement of meaningful activities. For example, I once worked with a younger man who avoided all sort of kind of leagues and sports he used to, because when he would show up at his activity, people would be like, hey, how's your health? How's it going? And that made him think of cancer. So he stopped going to all these activities, even though he liked it. And that really had an impact on his mental health. So those are the kinds of things that fear of cancer recurrence can do. And from a practical sort of systemic impact, we know that cancer patients who experience fear of cancer recurrence might be fearful to leave the cancer center. And depending on the kind of cancer people have, they may not have the option of staying at the cancer center now forever. A lot of cancer patients are being transitioned back to their primary care provider, whether it's a nurse practitioner or a family physician. So those that have high fear of cancer recurrence may be more fearful to leave. So fear of cancer recurrence interventions can help with that transition back to primary care. Basically, now we know that fear of cancer recurrence interventions work. So whether you are seeing somebody one-on-one, a qualified mental health therapist, or you're taking part in a group that focuses on fear of cancer recurrence, chances are that this is going to do wonders for your fear of cancer recurrence. Now, what's tricky is getting access to those interventions. So that's the next research challenge that I'm working on, is how do we make these interventions more accessible to people? In other words, how do we implement these interventions into routine care? I often say to people that I work with clinically is, if you feel like your fear of cancer recurrence is bothering you and you need help with it, that's probably a good indication that you need some help and that it's time to seek, maybe some assessment and just see what solutions are available to you. Or simply, if we ask you the question on a scale of 1 to 10, where 10 is the most intense fear, 1 is no fear at all, if you're answering a 5 or above, that's probably a good indication that you need additional help with fear of cancer recurrence. The next challenge for us is to bring them into routine care and make sure that cancer centers in Canada are screening for fear of cancer recurrence. So I would say that's really one of the big challenges right now. The second big challenge that we're working on, thanks to funding from the Canadian Cancer Society, is what we call implementation. Together with a colleague who was the Princess Margaret at the time, Dr. Christine McGill, we developed an intervention called FORCE, which is a cognitive existential intervention. So cognitive because we're looking at your thoughts and how you are processing your thoughts. And the existential is to really address the fact that your fears are, for the most part, not crazy fears. You're having realistic fears and concerns about the cancer coming back. And how do we help you focus on values and things that are meaningful to you? So we have money now to a grant to bring forth to 5 different cancer centers across Canada. And our goal with this study is basically we're going to have these different cancer centers offer forth to women with breast, any gynecological cancer or hematological cancers, And there's no control group. We're just rolling it out, and we're seeing what are the challenges that each cancer center is going to encounter to bring what we call an evidence-based practice into routine care. One of the questions I often get asked when I talk to groups of cancer survivors is, what can I do to help myself? So once you've sort of assessed for yourself that fear of cancer recurrence is a concern, that this is something that you're struggling more than you would like to, and you sort of answer that question for yourself of 1 to 10, and you're rating yourself as 5 or above, and you feel like that you're experiencing this fear outside of just those scans, those appointments I mentioned, then I think it's time to start thinking about some tools. So the first thing I would do is check with your local cancer center, see what they offer in terms of support from their psychosocial oncology team, and see what's available there. There are lots of options now available online through partners like Wellspring, for example. So see whether you can find something there. So there are benefits, as I said, to being in a general support group. But in addition to that, I think there are things that you can do to help yourself. I would say the main one when you're dealing with fear of cancer recurrence is to actually try to face the fear. So this is very counterintuitive, because when we're anxious about something, we would much rather avoid it. The same applies to me. When there's something that I'm fearful about, sometimes I try to push it and procrastinate and sort of leave it because I'm anxious, and more when I avoid it, my anxiety decreases quickly. So I like to just sort of push it aside and not really think about it, and that makes me feel better. So that's very common, and we all do that. The problem with the people that come to see me for help with their fear of cancer recurrence is that tends to be their main coping strategy. And they tell me, I know I've got this fear. I try to push it aside, and just not deal with it. And I try to keep myself very busy, and I sometimes keep myself busy from morning till night. You should see my agenda, Sophie. And then the problem is when I go to sleep. And then at that point, the fear comes back. And, I'm wide awake and I've got nothing to do to distract me. So I think instead, what I encourage people to do is imagine that your fear of cancer recurrence is in this little box. And every day you're going to try to open that little scary box and look at it a little bit more and a little bit more and a little longer. So you can do that by yourself. You can do that by writing. You can do that by talking to a supportive friend, another cancer survivor, and just talk about your experience. Getting into the specifics of your fear and writing it out is usually the most helpful part of FORT. This is something you can do, keeping in mind that your mind is probably going to the worst scenario. So what we do in FORT, we get people to actually write out their worst scenario and then start making a plan for their worst case scenario. I think as human beings, we do better when we feel somewhat prepared. I think it's more that we hold on to hope. So you could have a best case scenario, but you could also have your worst case scenario and be prepared for your worst case scenario. So examples of what I mean by being prepared could be some things like doing a will, doing some sort of legacy work for your family. And when people have done that, they usually feel they've got more of a sense of control. So I think this is something you could do. And a lot of people we worked with have shared their worst case scenario with their families. And that starts a conversation, because we often find that, the patients are thinking about their fear of cancer recurrence. Their family members are also thinking about the same thing. They're also going through the same thought process, but nobody's talking about it. So having a chance to talk and share your fear with your family member could, in some cases, bring you closer. So I would say sort of be specific about your fears, talk to someone who can listen to you. The second piece of advice I'd like to give is get some information from your healthcare team. So I've worked with many people who are not sure about, exactly their stage of cancer, their prognosis, their follow-up care. Why am I getting this type of scan, but not that other kind of exam? I'm not sure who's in charge. Is it my GP? Should I go back to the oncologist? I'm not sure what to do here. I think it helps when we're faced with uncertain times to focus about what's meaningful to us. So as cancer patients, probably you feel like your views have changed, some of your values, some of your priorities. You may feel like you're a slightly different person. If you're not, that's fine too, but Often people tell me, well, I've changed. There are things that no longer matter to me. It's a good idea to focus on what's really important to you. What are your top priorities? What do you want to, do, or who do you want to be with? What's important to you in the next? We start sometimes with the next day, the next week, the next month, and we sort of build from that to sort of overcome that fear, that paralyzing fear. Fear of cancer recurrence is really a worry about something that could. Really, the word here is could happen. This is a hypothetical scenario in the future. It could happen, but it hasn't happened yet. Or it may never happen, or it may happen in a very different way than what you're envisioning. So we get people to try to focus more on now and what's in your control now.